Welcome to Deep Sleep Diaries, brought to you by Foam, the show that helps you break the cycle of sleepless nights and wake up positive. Hi, I'm Abhirami, and today we're in conversation with Dr. Ramakrishnan, a leading expert in sleep medicine. Hi, Doctor. Welcome to the show. Could you tell me a little bit more about who you are and how you got into sleep medicine and your credentials, please?
Thank you for having me to create awareness on this very important aspect of life, sleep. I'm Dr. N. Ramakrishnan. I'm an American board certified physician in internal medicine, critical care medicine, sleep medicine, and obesity medicine.
Wow, okay.
And before you wonder what is the link between critical care and sleep medicine, I initially was a critical care doctor, and I noticed that patients in the ICU don't sleep well.
Hmm,
Their families don't sleep well because they're extremely anxious about how the
right.
patient would do. And more importantly, we also noticed that there are several sleep problems that have been undiagnosed that probably led this patient to coming into the ICU. That's how I started getting interested in sleep medicine. So I got board certified in sleep medicine, and I've been practicing sleep medicine since the 1990s. So well over 30 years now.
I have to start the show with the most important question. How well do you sleep?
Extremely well.
Well, you're the right person to chat with us then. Can we start
Absolutely.
our show?
Absolutely.
Okay. So, we all know that after a good night's sleep, we feel good. But as an expert in the field, I want you to tell me a little bit about why sleep is so important for our physical and mental health.
Yeah, most people view sleep as just a period of rest when it's a lot more than that.
Hmm.
There's so many changes happening in our body during the night, right from blood pressure fluctuations to heart rate fluctuations to how you breathe. All of those are different, and there are a lot of hormonal changes that happen. So, overall, it's a period when you are actually repairing and restoring not just your brain, but really your entire body,
Wow.
which
Okay.
is why any changes in the sleep, whether it is the amount of sleep, the
Hmm.
quantity of sleep, or the quality of sleep, or if there are issues with your oxygenation during sleep, any of these problems leads to not just mental health issues but also chronic physical health issues.
Hmm. So you said that during sleep, it's not just the rest and recovery, but there is a little bit more that happens in the background. And I've heard a little bit about the different stages of sleep. So you're not always in deep sleep,
Mhm.
right? So
Yes.
can you just walk me through what the different stages of sleep are and how they sort of affect your body?
Sure. So there are four stages of sleep, what we call stage one or N1,
Okay.
stage two or N2, stage three or N3, and what we call REM sleep. So I'll start with the REM sleep because it's called rapid eye movement sleep.
Right.
And what happens during REM sleep is that your entire body muscles are actually almost paralyzed. Your muscles are not moving at all. The tone of the muscles is extremely low, but you're moving your eyes. So that's why
Hmm.
it's called rapid eye
Rapid eye
movement
movement.
sleep.
Hmm.
Now, why I started with that is the other three together are called non REM sleep or
Okay.
NREM sleep. And stage one sleep is very minimal portion of your entire sleep, just about 3 to 5% of your sleep. And
Is
it
that when you like actually start to fall asleep?
starting to fall
Okay.
asleep.
Hmm.
So that is stage one. The majority of our sleep is actually stage two sleep or N2 sleep, which about 45 to 50% of our entire night sleep is stage two.
Okay.
N3 or stage 3 sleep is also a form of deep sleep of the non REM type,
Hmm.
and it's called slow wave sleep. And
Okay.
because that's when, again, there are specific things that happen. And one quick example I would like to say is the good old grandma used to say, like the child needs to sleep well to grow well.
Right.
And in stage 3 sleep, the growth hormone is secreted.
At
And
all
that
ages or only during childhood?
during childhood.
Okay.
So that's the reason why it's important for them to get good deep sleep
Hmm.
and they grow well at that stage. And REM sleep happens approximately every 90 to 120 minutes. So, in a night of about 7 to 8 hours of sleep, we may go through 3 to 4 cycles of this non REM and REM sleep.
Hmm.
It's not typically like 1, 2, 3 REM, 1, 2. It's not that way. You could go from stage 3 to stage 1 if you're waking up to go to the bathroom, and then you again come to REM sleep.
Right.
But approximately every 90 to 120 minutes, you get a REM sleep.
Hmm.
Now, in the initial part of the sleep, which is before midnight, the REM sleeps are very short, like just 5 to 10 minutes. Whereas the later half, like in the early mornings, the REM sleeps are a little longer, like it could be 30 to 40 minutes.
Hmm.
One trivia about REM sleep is you remember dreams that happen only during REM sleep.
I
That's the
see.
reason when you wake up in the morning, you might remember your dream completely. And
Right.
so that's what happens during
But
REM
you
sleep.
dream in all stages of
You can
sleep
dream in
then.
any stage of sleep,
I see.
but it's remembered only when it happens
In
during
the
REM
REM
sleep.
sleep.
Otherwise, it'll be very fussy. People say that something happened, I can't remember a
Right,
thing,
right.
but during REM sleep, they can remember what it was. Yeah.
Interesting, interesting. Another point you mentioned in my first question was the connection between sleep quality and mental health as well.
Mhm.
Now, that's not something that's very instinctive. Can you talk a little bit more about that? Like how quality of sleep affects your mental health?
So I think it's best thought about with an example. Like,
Sure.
imagine one night when you didn't sleep at all. How do you wake up? You wake up feeling
Groggy.
irritable, groggy,
Hmm.
you can't focus, your concentration is less. Very quickly, you could be snappy, your productivity comes down,
Hmm.
you're kind of withdrawn. If possible, you would go to sleep. So multiply this several fold if you're not getting good quality sleep for many days.
Many
So
days.
that's how it affects your mental health. You create what we call a sleep debt. You're sleeping less and less,
Hmm.
your body is getting less sleep, and then you can develop anxiety, you can develop depression.
I see.
All of those are very well known to be associated. In fact, in childhood, there's a lot of studies now saying that sleep disorders could be associated with hyperactivity disorders, ADHD.
Hmm.
All of those can be related.
Wow. So a good night's rest is not just a good night's rest, it's much
Abs-
more than that.
Absolutely.
Huh. And then what could be some like long-term effects, both mental and physical, of say poor sleep quality?
So again, as I said, when you multiply this, common mental health
Hmm.
problems are anxiety and depression. Those are the most common things that people can develop. In fact, a lot of people develop what we call bed anxiety, because if you
Okay.
don't sleep well,
Hmm.
you go to bed thinking, will I sleep, will I not sleep, and that makes them even more restless, and that disturbs
Harder
their
to fall
sleep.
asleep. Yeah.
Exactly. So there are people who say that I'm so depressed that I can't sleep, random thoughts come in. We get people who come and tell us that I feel suicidal, like, because I
Wow.
really want to sleep. I want a good night's sleep,
Hmm.
and I would do anything for it. Of course, a lot of people start self medicating. There are other issues that come with it, but these are some of the main psychological problems that happen.
Okay.
Now, there are people who don't sleep well, who feel groggy during the daytime, and are very socially uncomfortable because like they feel like when they're sitting amongst others, they feel groggy, they feel sleepy. So it also leads to what I would call psychosocial problems. It is not just there are marital disharmony
Hmm.
relating to improper sleep in either of the partners. That can be an issue.
Right.
And you also mentioned about the physical health
Mm-hmm.
problems. The common ones are, if you don't sleep well, you can wake up with aches, chronic, what we call pain syndromes can
Hmm.
happen with relating to that. Just feeling exhausted, weakness, all of that could be there. But it also leads to high blood pressure, diabetes, heart disease, and stroke.
Hmm.
And now we are increasingly hearing a lot of young deaths. And like when you hear
Right.
about a corporate person dying suddenly for cardiac arrest, then suddenly people wake up to saying, hey, he's not getting enough sleep and all of that, but people forget it too soon. The memory is
Right.
very short lived on that.
Doctor, so you just mentioned something called bed anxiety. Now, I can relate to that very personally, I would say. So I probably like do all of my preps to go to bed. But then the moment I hit the bed, all of the thoughts of the day come to me, or what I'm going to do tomorrow comes into my brain, and I'm just not able to relax. Are there, is there, could there be other reasons why the stress hits the hardest when you're actually trying to sleep?
So honestly, that's the time you are trying to unwind from everything else and go to rest, if I may
Right.
say so.
Sure.
So, in a way, it's a devil's mind because you don't have anything else in mind, but everything that happened during the day pops up.
Right.
So, you're trying to unwind and sleep, and some people find it very hard to, like, get out of what they have done during the day, or start thinking more and more about it,
Right.
which is why we always tell people that, see, unfortunately, sleep disorders are a lifestyle problem, no question about it.
Okay.
We all have longer days than before, uh, thanks to these cell phones, like our workday never ends.
Mm-hmm.
Like previously people were unreachable once they reached home,
Right.
but now, like we are all answering phones from all over the world at any time of the day, which delays our time to sleep.
Right.
And therefore we tell people that don't just work and try to hit the bed. Do something that would relax you, and that could be like sitting and reading a book or listening to some music.
Hmm.
Doesn't always have to be sitting and meditating, like
Okay.
something that you enjoy doing, but it's not just screen time. So, if you do that and try to relax, it certainly can prevent the bed anxiety. There are some muscle relaxation exercises that we teach as well.
Okay.
Basically, try to keep your eyes closed when you're in bed, and like clench your fist, slowly relax. The muscle relaxation gradually induces sleep,
Hmm.
and more importantly, you now have to concentrate on something else, and you're not thinking about all that
Right. Right.
happened during the day.
I've also heard of a military breathing technique that a lot of soldiers use to sort of induce sleep. Is that true, or
So
is that
again,
something
a
like that?
lot of these techniques are basically concentrating or focusing on something else so that you are not thinking about sleep, or you're not thinking about what happens during
Don't
the
think of the
day.
purple elephant, right?
Exactly, exactly. Yeah, that's what it is.
Okay.
So,
And so under this umbrella, you would probably say meditation, breath work. How about maybe keeping like a journal? Because if somebody is really bogged down by thoughts,
mhm.
would that help?
Yeah, absolutely. And in fact, we tell people, if you have a lot to worry, have a worrying time. Like just sit and worry and then you go and sleep.
Yeah.
That really does help. So, journaling or anything. But only thing we tell is that make sure that whatever you do before sleeping is outside the bed and not in the bed, because
I
bed is
see.
meant only for sleep and intimacy
Okay.
and nothing else. So therefore do not do other things in bed. So don't lie down and watch TV, or read a book or anything in bed. Do everything outside.
Interesting. I would never have thought of that correlation at all. So
So
also your mind is sort of prepped that it's sort of a Pavlovian thing, right?
absolutely, it's a mind association factor.
Yeah.
I mean, if I gave you a brush, you're not going to eat it.
Right.
So if I like gave you a bed, think about sleep or intimacy and nothing else.
Interesting. Okay. This is probably a little doing a little bit of a jump ahead or into a different topic because a lot of people are into fitness
Mhm.
and sports activities or a lot of heavy workouts. How essential is sleep for fitness enthusiasts or even sports people?
So, as I mentioned earlier, sleep is essential for you to be productive, fit, awake, fresh, and active the next day. There's no question about that.
Hmm.
Now, unfortunately, most of the runners, joggers, all of them try to do it very early hours of the morning.
Right.
I understand the reason, because the roads are, less busy and they're able to do that. But because of that, they wake up very early. And we
Right.
talked about the stages of sleep. What they are doing is essentially cutting one of their REM sleep to wake up to be fit.
Hmm.
But when in fact, they might be able to do the exercise, but then they feel tired and less productive during the daytime because it is affecting the quality of their sleep.
I
So it's a
see.
tough balance, but we tell people, if you are going to get up very early, try to sleep early so that you get your X number of hours and you get all the stages of sleep in the right proportion so that you can. So, cutting down the sleep or creating what we call sleep deprivation or sleep debt is
Right.
not the answer to fitness.
So 6 to 8 hours is what you would recommend, or is that age specific?
It is absolutely age specific, because
Okay.
a newborn would sleep 18 to 20 hours
Sure.
during the day. As the child reaches the school going age, they consolidate their sleep primarily in the night to
Okay.
about 9 to 10 hours, and they could potentially sleep in the afternoon if they are allowed to for another hour or two.
Right.
As they get to what we call the adolescent age group, they actually require somewhere around 8 to 9 hours of sleep. But I can't figure even a single adolescent getting that kind of a sleep today.
Right.
Adults require about 6 to 8 hours of sleep. And like even as we age, people think that older people require less sleep. Not true. They
Hmm.
also require 6 to 8 hours of sleep. So having the right amount of sleep at the right time is absolutely essential.
So, sort of jumping back to that athlete sort of a mind frame, can overtraining or lack of sleep, you said that, cutting out your quality of sleep and quantity of sleep, can that together lead to more burnout and more injury?
Absolutely, yes. So, as I mentioned earlier, it does lead to chronic pain, chronic fatigue, and all of that. And it has been shown that, particularly, it's kind of like works both ways. If
Hmm.
you do very significant exercise or all of that during later in the evening or night, it can impact your sleep.
Hmm.
And vice versa, if you are not getting enough sleep, you wake up not feeling energetic. I mean, that's very well known. I mean, there are people who say, I didn't feel like running today. I didn't feel.
Right.
Why? Because you're not getting enough sleep and you don't feel refreshed.
Hmm. Interesting. Uh, how about, hormone balance and your metabolism and all of that? Is that also affected by sleep?
Yes. If you don't get enough sleep, it can affect a lot of your hormones. In fact, there's a hormone called ghrelin, which makes
Okay.
you feel hungry.
Okay.
Okay. So if you don't get enough sleep, you feel more hungry, you feel like eating, you actually become overweight, which in fact
Oh,
can cause
wow.
other sleep problems. There's also a hormone called leptin, which is what we call a satiety hormone. If
Okay.
you have enough leptin in your system, then you feel like this is enough for me to eat.
Hmm.
So, people who don't sleep enough have more ghrelin and less leptin. So they feel
Ah,
hungry, but they don't feel that they're satisfied with what they eat. They feel like eating more.
okay.
So that's a very clear reason why they could be gaining weight if you don't actually get enough sleep. This is one.
Okay.
If you don't get enough sleep, it has been shown that your insulin levels, your what we call steroid hormone
Mm-hmm.
levels, all of those could be affected, and therefore your blood sugar could go up. You
I
could
see.
become diabetic, or if you are a diabetic, your control may be more difficult. If you're not getting enough sleep.
Right.
There was a very interesting article which was very appropriately titled Dying for a Good Night's Sleep, because basically it just says that if you don't get enough sleep, it's going to affect all your hormones.
Right. Right.
In fact, the rising infertility, the rising amount of polycystic ovarian disease, menstrual irregularities are
Hmm.
all thought to be related to irregular sleeping habits. Partially, I'm not
Okay.
saying that's the only
Sure.
thing that's
Sure.
leading to it, but it can contribute to all of these problems.
So, in the same vein, and this could be a little tongue in cheek, could all these things solved by sleeping a lot? Or is there like a happy place that you need to sort of stay at?
Oh yeah, I mean, sleeping too much is as bad as sleeping too little. No question about it.
Okay.
So sleeping the right amount uh, is what is recommended. Not sleeping too much.
Okay, so even though we've been talking about less sleep could lead to all of these things, the audience
Yes,
should realize that the solution is not just sleeping a lot more, but actually making sure that your mind is in a restful stage when you get to bed, ensuring that the quality of sleep is right, and sleeping the right number of hours,
exactly.
right?
Sleep enough. Sleep at the right time.
Yeah.
Make sure it's good quality.
Okay. How about napping? I know that you said children need a lot of naps, but my dad is a fan of napping after lunch. And I know many people who like those afternoon siestas. How does napping, is it beneficial or how does it compare to sleep recovery?
So, our body's what we call propensity to sleep
Hmm.
is highest at night or in the darkness.
Right,
The second highest propensity is post lunch.
right.
We all feel like eating, and it's like I mean, we all feel like sleeping right
Sleeping,
or
right.
napping right after. A nap should be a nap.
Okay.
By that I mean, 20 minutes, 30 minutes. It should not be a sleep for 2 hours.
Hmm.
So as long as it's a short nap, in fact, some cultures call it a power nap. You use the
Right.
right word, siesta. There is a siesta culture in Spain
Mm-hmm.
where they allow even employees to have a short nap because they feel that it powers them up and they are more productive.
Is there any truth to that?
There is truth in that.
Okay.
So if you are having a short nap, if your culture or your profession allows you to have a short nap, that's absolutely fine as long as it doesn't affect your night sleep.
Hmm.
So if there are people with problems sleeping at night, we tell them to avoid naps only because our body's total sleep time during the day matters. So
Right.
if you're sleeping for 2 hours in the afternoon and you're sleeping 5 hours at night, you may feel you're not sleeping enough, but
Hmm.
during the 24-hour period you've actually got 7 hours of sleep.
Right.
So we explain to them. So it all depends on, it's okay if it's not affecting your night sleep. It's okay if your work schedule allows it. Certainly for your dad, if he's okay with it, that's fine. But not otherwise.
Okay. He is a lucky man. He can sleep whenever he wants, wherever he wants. He lies down, he closes his eyes, and he goes to sleep. I mean, I am very envious of him because I cannot nap.
But make sure you watch on that, because when we think about somebody who sleeps all the time,
Yeah.
that can also be an issue. There are conditions called sleep apnea, which I can talk about, but
Hmm.
that certainly can lead to excessive sleepiness. So, too much sleep, too little sleep, both need to be checked
Both.
out.
Okay. Okay. Interesting. So you mentioned that bed should be considered as a sacred space where it is only meant for sleep and intimacy. So thinking of bed, you automatically think of a mattress. What kind of a role or how important a role does mattress play in the quality of your sleep?
I'm not a mattress expert by any means, but I am going to talk now both as a sleep specialist and as a consumer. Okay. What do I look for in a mattress? Number one, it needs to be comfortable. Okay. Number two, it needs to be durable, lasting long. Number three, I shouldn't have any allergies or, more importantly, I need to be able to co-sleep in it comfortably,
Correct.
because the requirements for bed partners may be completely variable.
Right.
I might prefer something very firm, somebody else might prefer, something soft, but we want something that is comfortable. There are so many options that are coming right now, but it's important to choose something that meets whatever I said. Like, it has to be comfortable. It doesn't, you don't want to be lying down and sinking.
Right.
It needs to be firm enough. There are people who specifically may need some what we call orthopedic beds or stuff, only because like, it helps more with the spine positioning.
Okay.
um
So that's not just a marketing term, that actually has some medical background.
medical meaning, like, it is only for people who have specific issues, but can be addressed. Primarily all that it is doing is like positioning right,
Right.
and more importantly, like, preventing some of the pain points when you're trying to sleep. That's what.
Okay. And how about people that have specific issues like backache and neck ache? I have had backache since I was a teenager, and I'm a side sleeper, and I tend to toss and turn a lot during sleep. What kind of things should people look for when they shop for mattresses who have these kind of specific issues?
So they need to find a mattress that's, like, firm, comfortable, and along with the right kind of a pillow.
Correct.
Okay. The so-called ones that are like modifying, like, to your positions may sound very fancy and interesting, but in the long run are not going to help you. So you need something that's firm, not just like, totally changing to whenever you are moving around, but at the same time, it should be comfortable.
Right.
So that's what we are looking for in the mattress. Again, there are different ones. I mean, I told you I'm not an expert, but there are coir mattresses, there are spring mattresses, there are, latex mattresses, and all of those. And my concern is that, like, you need something that's not allergenic, because there are some contents of these that could cause allergy, because
Mattresses using adhesives to keep all of the layers stuck together. Okay.
and also dust mites and all of those are a little bit more in some of these mattresses, and it's thought that the new latex mattresses are hypoallergenic and can probably help with preventing some of these allergies. So um, we need to look into all of that while we are and more importantly also temperature comfort, like the latex ones are thought to be like preserving the cold, like when you are during cold weather it could be comfortable. It's also going to be comfortable during the warm weather. So again, I'm not great at the chemistry of those or what exactly it does, but it certainly having that comfortable environment to sleep is absolutely important. Not just the mattress, but around you, the right room temperature, the right kind of lighting, all of those are important. And most couples play the remote game in the night, like one wants the air condition, one doesn't want, one wants the lights on, one doesn't want. So I mean, we all do that, but I think somewhere finding a good biomedia makes a difference.
They say that you've matured when you realize that you can find the happy medium when it comes to room temperature, right? Interesting. I know you said you're not a mattress expert, but over the years of your experience, can you talk a little bit about how frequently you should probably change your mattress or your pillows?
Most of the mattresses, like probably can be used for about 6 to 10 years is what most of them are saying. There are ones that are slightly longer lasting now. It's thought to be that the latex one can be used even for about 10 to 12 years. But I think that is something we have to go by how you feel. Like if you feel that the firmness is, there are people who rotate their beds, like they keep moving it around so that it's the same pressure. Yeah. So that it's not the same pressure that's, sinking the bed or whatever. So if you feel that it's beginning to get uncomfortable or causing aches, causing pains, make not giving you a good sleep, I think it's time to change. And that's where having one that's longer lasting would make a difference.
Right, right. I want to switch the tone up a little bit and get into a little bit more fun stuff. I'm sure you've heard of a lot of sleep myths over the years of experience that you've had in this field. What are the most common sleep myths that you've heard that you really think you want to debunk?
Number one is people thinking that they can catch up sleep.
Ah, okay.
Okay. Because people say that, oh, during the weekdays, I'm extremely busy. And then, like I sleep only 4 hours during the weekdays, but then I sleep for about 12 hours during the nighttime. Okay. During the weekend, sorry. So I would equate that to starve yourself for 5 days and eat only 2 days. We can't do that. And it's the same. So that's where, having that right rhythm, sleeping at the right time for enough number of hours would make a absolute change in your overall life and wellness.
Okay. So that's the top myth that you would. Anything else?
And I think people take sleep for granted. Like they say that why would I need to see a sleep doctor if I don't sleep well? Like only because sleep is natural. Sleep has to come naturally. So the myth is that like they should be able to sleep anytime. They should be able to sleep enough, and they kind of delay identifying even a problem.
I see.
So I think if you go and ask anyone, they would know who a cardiologist is, they would know who a neurologist is. Half of them won't even know that there are sleep specialists around. So I think that's another myth, that people fail to understand that sleep disorders are like anything else. Just like how you would treat your blood pressure or your diabetes, you need to get your sleep disorders treated.
Interesting. So for the people that say that, I'm okay sleeping just so many hours and I can catch up, is that really okay? Like 4 to 5 hours when they say that this is a weekday, I have a lot of things going on. Can people actually thrive on that? Because I've met a lot of people, especially in my industry, where your hours are so erratic, they'll say, okay, it's okay. That's fine. For months on end, they'll sleep just 4 to 5 hours. Is that okay?
It's kind of training your body to do the wrong thing. That's exactly what they are doing. Because, yes, there is variability in how people sleep. There are people who are very light sleepers, like any movement, any noise, they would wake up. There are people who are deep sleepers who don't, wake up. There are people who absolutely need 8 hours or more. There are people who are fine with 6 hours or less. So there's a lot of variability in how people sleep. But as I said, on an average, it is 6 to 8. But what you need is very specific for you. I can tell you my own example. Between 10 and 10:30, I have to sleep. Like if I'm watching a movie, I doze off, and that's not something that goes well. So I have to sleep. And similarly, whether it's a Sunday or a holiday, I wake up between 5 and 5:15. Okay, so and I have to get up and go for a walk or do something, so it's a very fixed time. Now, having said that, on a day when I have to wake up at 4:45, I feel terrible because I need exactly that duration of sleep. So each human body needs a certain amount of sleep to be awake, alert, active, and fresh the next day. If you don't get it, even if it's 15 minutes less, then it can be a problem.
Okay. What are your thoughts on sleep monitoring devices? Because when they came out, like I used to have a watch. I've tried something else. The ring, not yet, but I'm very tempted to get that. The phone being near you, that it sort of measures your breathing rate or whatever it is, all of those things. But I find myself every morning I go and look at my chart, and I sort of look at that. What are your thoughts on that? Is it a healthy habit to follow, or do you think it causes more anxiety?
I tried a smartwatch.
Uh
I became smarter and I'm using a regular watch.
huh.
So I feel the issue is that it's good, like you
Yeah.
have the data, but a lot depends on the personality.
Okay.
If you look at it and you say, okay, I need to watch out and I need to sleep better periodically, then
Hmm.
you're okay. This is like saying, like, do you weigh yourself every day? Do you get your blood pressure every day? Do you check your blood sugar every day? You don't.
Right.
At the end of a month, you might say, my weight has been up a kilo or, down a kilo or whatever. So, similarly, monitoring it too much can lead to anxiety. I've had people who have come to me saying, I'm not getting enough REM sleep.
Hmm.
And I'm like, what's your problem? So, I don't have a problem, but my watch is telling me I don't get enough REM
Oh,
sleep.
wow.
So that's not what we need. While this data is very important, while it can be helpful, I feel that we need to take it the right way,
Hmm.
and it needs to be taken with a pinch of salt because these are basically they are motion sensors. So they are pretty good for determining the duration and when you are sleeping, but they are not good for assessing the depth of sleep. So if you come and tell me I'm not getting enough deep sleep, it may not be perfect. You need to be
I
cautious.
see. I see. Okay. So, to wind down our conversation, sleep is something that we all, as you rightfully said, take for granted because it's something that almost automatically happens in our body. But there is so much more to it than just falling asleep and waking up the following day or after a few hours. The quality of sleep, the quantity of sleep, the ambience in which you sleep, the mattress that you lie on, your rituals before you go to sleep, and also even from a medical standpoint, the other health issues that could arise because of poor sleep hygiene, poor number of hours of sleep. This is, I think, a world that has not been explored as much. And today has been a very enlightening conversation. Some of the conversations, some of the topics that I was familiar with, and there were some things that I completely hadn't thought about. Like I didn't know about the 4 stages of sleep. I knew about REM because I'm a very vivid dream seer, but the rotations of those things. So, very enlightening conversation. Thank you so much for spending so much time with us and giving me and our audience so much insight on something that we considered so mundane, if I may say so. I hope you continue to get restful sleep every day, and I would wish the audience also gets that. And thank you so much once more.
It was a real pleasure, and I was happy to share my thoughts on the importance of sleep, identifying the sleep disorders earlier, and seeking help, so that you could really prevent long-term problems, both physical and mental. And it's really good that we are creating an awareness on this, and I'm happy to be part of it. All I want to say in the end is a good night is essential for a good day.
Yes.
So absolutely make sure that you have good nights.
So I want to try something fun and quirky to end the show. I'm going to throw out some words that are related to sleep at you. And in a few words, if you can just respond to those, that'll be fun. Okay?
Sleep is fun, but it can be serious
It
if you miss it.
absolutely is serious. My first word is rest.
Well,
Rest well.
rest well. I think that's what is most important.
Right. Sleep wellness.
Often forgotten, often ignored, and usually help is sought when it's too late.
Ah, that is the most important thing. Okay, symptoms.
Identify early. Not sleeping is not the only problem. Excessive sleepiness, waking up often during sleep, and having trouble initiating sleep. All of these could be a problem. Snoring or anything abnormal during sleep is also a problem.
Okay. How about sleep ritual?
Each one his or her own, and it can vary right from the child holding the mother's sari to something more significant, like there are people who like a particular pillow in a particular position between their legs,
Right.
move around. There are some who like a massage of their legs. So, again, to each, whatever ritual works best. But it's absolutely important to develop some kind of a ritual so that it kind of creates the beginning of your sleep pattern.
Triggers a sense of sleepiness.
Yes.
Okay. Um, would you mind sharing what your rituals are? Because you said you sleep really well at the beginning of the show.
So when I go to bed, have to turn off all the lights. I just go to bed, and I do have a pillow ritual
Okay.
where I have to have it under my leg and immediately turn to one side
Okay.
and keep my hand under the head, and I start sleeping. It takes me just about 5 minutes or less. And
Oh,
I
wow.
start
Knock on wood. I hope you stay the same.
I hope so too.
How about must do's?
Have a regular sleep schedule. Absolute must. Like once in a while, deviating is okay, but having a regular schedule is important. Sunlight exposure in the morning is absolutely important for a good night's sleep.
Is there a certain happy window that you would suggest? Because too much sun exposure could also have problems.
Yeah, somewhere around 15 to 20 minutes for at least about 4 to 5 days a week
Okay.
is good enough. Eating on time, particularly your dinner 2 hours before bedtime, is important. And then some unwinding which works for you at night.
Okay. I think we've covered everything. So sleep good and wake up positive.